Wonderful. I'm going to go ahead. Be providing. Are we ready? Okay. Good afternoon. I am Mayor Paulette Guajardo. Today, we will be providing you with a COVID-19 update. Yesterday, we launched the City of Corpus Christi's Saving Our Seniors program. Our City Council understands that more must be done to assist our most vulnerable seniors in their homes. And I'm pleased to share with you that our Corpus Christi firefighters vaccinated 108 homebound seniors with their first dose of the Moderna vaccine yesterday. The Saving Our Seniors program allows our Corpus Christi firefighters to visit our homebound seniors and disabled populations. Here is some very important news on this program that everyone has been asking about. We are launching a pre-registration hotline for the Saving Our Seniors program. Residents will now be able to call in to a dedicated line to register for the SOS program. The hotline number to pre-register is coming next week, and that information will be available to you very soon. And here's some more good news about the program Saving Our Seniors. Our firefighters administered over half of the doses yesterday to all 5 city council districts. Coming up next week, we anticipate administering 400 to 500 vaccines through the SOS program. We want to thank our firefighters who worked so hard to make this happen. I also want you to know some very important news from the federal government. President Biden spoke to the U.S. Conference of Mayors this weekend. He told us that he will work to get us the vaccinations we need, and the Biden administration announced today that it was on the cusp of securing an additional 200 million doses of the 2 approved coronavirus vaccines. This purchase would increase available supply by 50%, and this means that in the coming weeks, more vaccines are on the way. Here is some really good news that everyone needs to know. Starting next week, the City County Health District will have 2 regional vaccination locations. One will continue to be at the Richard Borchard Fairgrounds in Robstown, and the other will be at the American Bank Center in Corpus Christi. We anticipate to receive 500 vaccinations on Monday, February 1st, which will be administered on Tuesday, February 2nd, at the American Bank Center. More details are forthcoming. Also, very important news you will be hearing more about today from the county judge is the City of Corpus Christi and Nueces County Health District held a vaccination clinic at the Richard Borchard Fairgrounds in Robstown yesterday. We were able to successfully administer 5,000 doses of the Moderna vaccine in just over 9 hours. This effort indicates to the Department of State Health Services that we can effectively and efficiently hold a mega vaccination clinic and administer thousands of doses in one day. To everyone who attended that vaccination clinic yesterday, we are grateful for your patience and understanding, and we thank all the volunteers and staff who worked so hard to make this vaccination clinic happen. There is more good news locally. The team has been working with Driscoll Children's Hospital to open their site at the American Bank Center. This site is another option for residents to be vaccinated, and more details are to follow as well. I want you to know that your City Council and I are listening to your phone calls, reading your emails, and reading your messages. We understand that the urgency of opening an inner-city vaccination location, and we're working to accomplish that by early next week. We must create greater access to both groups 1A and 1B and be vaccinated as quickly as possible. Serving our senior citizens is our top priority. And next, we will hear from our county judge, Barbara Canales.
El día de ayer lanzamos el programa de la ciudad de Corpus Christi Salvando a Nuestros Mayores, o SOS, para ayudar a nuestras personas mayores más vulnerables en sus hogares. Nuestros bomberos de Corpus Christi vacunaron ayer a 108 personas, adultos mayores confinados en sus hogares, con su primera dosis de la vacuna Moderna. Estamos lanzando una línea directa de preinscripción para el programa Saving Our Seniors. El residente ahora podrá llamar a una línea dedicada para registrarse para el programa SOS. El número de la línea directa para preinscribirse llegará la próxima semana y esa información estará disponible para usted muy pronto. La próxima semana anticipamos la administración de 400 a 500 vacunas a través de ese programa. El presidente Biden habló en la conferencia de alcaldes y dijo que trabajará para conseguirnos las vacunas que necesitamos. Esperamos contar con un aumento del 50% en cuanto a vacunas. A partir de la próxima semana tendremos 2 ubicaciones regionales de vacunación. Una seguirá siendo en el Centro de Exposiciones Richard Borchardt en Robstown y la segunda será en el American Bank Center aquí en Corpus Christi. Esperamos recibir 500 vacunas el lunes 1 de febrero, que se administrará el 2 de febrero en el American Bank Center. Los detalles se los vamos a dar la próxima semana. El día de ayer logramos inmunizar con éxito a 5,000 personas con la vacuna Moderna en poco más de 9 horas. Este esfuerzo le indica al Departamento de Servicios de Salud del Estado que podemos llevar a cabo de manera efectiva y eficiente una megaclínica de vacunación y administrar miles de dosis en un día. La ciudad ha estado trabajando con el Hospital Infantil Driscoll para abrir su sitio en el American Bank Center. Este sitio es otra opción para que los residentes se vacunen. Quiero que sepa que el ayuntamiento y yo escuchamos sus llamadas telefónicas, leemos sus correos electrónicos y leemos sus mensajes. Entendemos la urgencia de abrir un lugar de vacunación en el centro de la ciudad y estamos trabajando para lograrlo a principios de la próxima semana.
Good afternoon, everybody. Barbara Canales, Nueces County Judge. The comments I have for you today were really meant for yesterday, and because of yesterday's significance, I think it bears noting that we should repeat those comments. Although I uploaded them to YouTube, we didn't have the benefit of having this press briefing, so here goes. Now, yesterday, I spent the day at the Richard Borchardt Fairgrounds, where the City County Health Department and a unified command delivered over 5,000 vaccines, 5,224 to be exact. This is an incredible accomplishment, and it shows that we have got a system that can distribute vaccines in quantity to our most vulnerable people as fast as possible. So, there's no doubt that 5,000 plus vaccines being delivered between what we did at the fairgrounds and also what Chief Rocha and CCFD was able to do is really indeed good news. But there's always a bad news, and the bad news is that the City County Public Health Department that's all we have for the week. I wish it were more. I wish we could do 5,000 every day. And so there are 3 takeaways from my comments today from this briefing. The first is that vaccine demand exceeds supply, and our vaccine delivery capability also exceeds supply, and we're going to go over that in detail. Second, we expect a steady level supply through the end of February. And third, and probably the most important, is that we're going to be immunizing our current groups, that is 1A and 1B, for the next few months. And at the current rate of vaccine production, we would be looking at early summer before we moved on to another group. Now, Mayor Guajardo's comments are very important because, as she noted, with the conversation the Biden administration had with the Council of Mayors and also with the American public, we know that there are plans in the works for the acquisition of over 200 million new vaccines. And more excitingly, we have the opportunity to have a third one in production very soon, potentially. So now let's go back that I've summarized the 3 points. Let's go back to that first one. Vaccine demand exceeds supply. And our vaccine delivery capability also exceeds supply, which is actually a good thing. The demand for vaccines is enormous, and the two vaccines that we currently have, the Pfizer vaccine and the Moderna vaccine, are being produced in our nation as fast as they can make it. And unfortunately, there is a physical limit to their production. Both of these vaccines require 2 doses. The significance of this is that if 1 million doses are produced, that doesn't mean 1 million people are vaccinated. It means 1 million people will need a second dose in a few weeks. So additionally, our vaccine delivery capability also exceeds supply. And as good as we are, what we've done is prove that when there is more, they can send us more. But there's no more to send, unfortunately, this week. Now, the state of Texas has paused opening additional hubs like our mega clinic. It doesn't make sense in their minds to open more storefronts if there's not more merchandise. Now, when vaccine supplies increase, they will consider opening additional hubs. This is the message I bring to you from DSHS and the conversations we've had this week. But as we already have a regional hub in Nueces County, they will likely open hubs in rural Texas where there is no hub. So this is true also for the metropolitan areas of Texas. It's not for a lack of distribution. It's a lack of supply. So the information that you've just heard is creating more distribution in addition to all of the great providers that we have in our community. Earlier today, I held Commissioner's Court, where between myself and Melissa Munguia, our emergency manager coordinator, we delivered the message that over 48,000 vaccines have been allotted to our county. But we still have, according to the state records, only about 28,000 of which have been distributed. So we are not the only provider here at City County Public Health. There are many providers. Unfortunately, it's still not enough. So what does the supply forecast look like? Well, we expect a steady, level supply through the end of February. And we are getting all we can, but the factories can only make so much. So the good news is, and I alluded to this, is that Johnson & Johnson, the manufacturer, has a vaccine candidate. That's what they call it when they're ready. And they want to submit for approval very soon to the FDA. This is part of that emergency authorization use, the EAU. So what that would do for us is give our nation a third supplier. This is a game changer. And the good news is that this Johnson & Johnson vaccine is designed as a single-dose vaccine. So that will help us tremendously if approved. And I don't mind telling you that I shared on radio this morning that J&J is perfect for our homebound seniors because and our disabled, because it's only one shot. This is a game changer also for the Corpus Christi Fire Department. Additionally, President Biden signed an order allowing the Defense Production Act to be used for the manufacturing of vaccines and all of the support equipment. So you see, it's not just the idea of the product, but just like in testing, you need all the supplies. So we've got to make sure we have enough syringes, alcohol swabs, gloves, masks, and even Band-Aids. And when we bring all resources to bear on this problem, I'm confident that this country can make amazing things happen. And this will inevitably, increase our national production. And why is that great? Because that means we'll get more in Texas, and when Texas gets more, Nueces County gets more. And third, and again, back to my bullet points as I open, the most important, we're going to be immunizing our groups 1A and 1B for the next few months. And at the current rate of vaccine production, we would be looking at early summer before we moved on to the next group. And again, who's 1A? Who's eligible? Those are all our first responder, medical personnel, frontline healthcare workers, and those involved with the transport of those COVID-19 patients. And who is 1B? Those are the over 65 population and those over 18 living with comorbidities. And so we're going to be continuing this process, and I want you to understand this timeline through summer and fall. In fact, I'd really like for you to have this timeline sink in. so we can all be on the same page. Now, boy, do I get a lot of emails and calls to answer, and it seems like they're such simple questions, but the last mega clinic was for over 65 and those with comorbidities, and it just seems like we should be able to move on. But the number of people who are over 65 in our community and those living with complicating physical health conditions is enormous. In fact, how many times have we reiterated this point? Nueces County has 50% more people over 65 than the state average. And we have more people with complicating conditions. Our population is less healthy, it's less insured, it's less wealthy, and all of these put together, these social determinants of health, put our population here in Nueces County at greater risk for coronavirus infection becoming, unfortunately, a fatal case of COVID. It won't be done in a single clinic. The mayor and I agree. We have to have a network of clinics, pharmacies, and locations in order to address our needs. And for the many who have asked, we are working to track first and second doses, and we're not going to divert second doses so we can get more people first doses on the hope that supply will increase, because it will not for the next few weeks. The state of Texas knows that the doses they send need a second dose in a timely manner. They know this. They plan for this, and we're getting those. In fact, on Friday, you'll hear Annette Rodriguez talk about the fact we're running a vaccine second dose clinic at the fairgrounds for 500. Those are the 500 that are needing the second dose right now, and we have them. So please trust that if you get a first dose with us, you will get a second dose. And so, wow, that's a lot of hard truths, right? Remember, I started off so excited, but I have to be able to give you these hard truths. And we made some progress yesterday. We really did. In fact, I told our court earlier that at the cover of the Wall Street Journal today are our student nurses from our university, with our people, in our county assets, for the nation to see how vaccinations can be done efficiently and appropriately for those that are eligible. Delivering 5,000 vaccines plus to our most vulnerable as fast as possible is, quite frankly, an immense source of pride for me. But it really belongs, the credit belongs to the team that made it happen. And so I need you to know that this team understands this basic premise, that when we say our most vulnerable, put a little asterisk, a little star by it. Because really, what it means is that the most vulnerable who have the capability to get in a car and wait a long time. Even though we can produce 533 vaccines in an hour, which is fast, it took us 9 hours to do that many. Record time. But 9 hours is a long time if you're a number 5,000. I want you to know that we acknowledge that. But I have to say that these efforts that are being made to reach out to those in their home is also a great source of pride. And I want to thank Chief Rocha and the City of Corpus Christi's Save Our Seniors program, which we originally dubbed the Homebound Hotshot program, where our firefighters are bringing those life-saving vaccines to those who cannot leave their home. And you should know this did not arise this week. This was our plan from months ago, and you heard it here with Chief Urban, Chief Quintero, and Chief Rocha, who accompanied us here at this very press briefing about a month ago. Does it take time? It does. But we got it right yesterday. And so all of the folks that are delivering vaccines around the county, not just us, but all the ones that I mentioned earlier, including our long-term care facilities and our hospice and our home health agencies, our federally qualified health centers, I salute you today. because you too are working to get that vaccine as fast as you can. So look, I want to end with this. There's a key to getting more vaccine, but that key unlocks the door when there is more vaccine to get. We will not allow our vaccines to sit on a shelf in City County Health. We get them to as many people, again, as fast as we can. And here's the thing that we're going to pivot to this week. I like sharing with you that tune in, where are we going? What's our plan and strategy? We're going to be calling all of these providers, and we're going to find out how to get that number down to 0. There should be no vaccine for first dose left. It needs to get out, and we're going to help them get it out. So, by working with the providers to see if there's anything we can do to help expedite that delivery for the vaccines they've already received, that will help us get more. But it's going to be steady. It's not like we could get more than 5,000 at this point. They've told us that. So we're going to have to do 2 things. Learn how to live with one another with these incredible rules of inequity, but we've got to do it in a way that makes sense and a way that's unified. So let me turn to the people who were in those lines yesterday, and let me turn to the staff that was helping those people. Thank you for your grace, your kindness, your encouraging words, to those who were working to direct traffic, collect information, or deliver the shots in your arms. The truth is, I wish all of you could see what I see when I'm out at the fairgrounds. I know all the problems. I know you know all the problems. But may I just say how truly beautiful it is, Annette, to be out there? We should not lose sight of that. We should not lose sight of His grace to be in this amazing time together, this amazing good fortune to have this many vaccines in our community to protect one another. We know that you are counting on this vaccine to protect you. But more importantly, you're counting on us to get it to you as quickly as possible. So I look forward to working under unified command to getting you our next shipment of vaccines. Yesterday, we set a record. Tomorrow, unfortunately, that means nothing. We've got a lot of work ahead of us, and together, we will make it happen. Thank you so much.
El día de ayer logramos la inmunización de 5,224 personas en total, lo que demuestra que tenemos un sistema que puede distribuir vacunas en masa en corto plazo. Desafortunadamente, este fue el único cargamento de vacunas destinado para esta semana. En 3 tópicos. La primera, la demanda de vacunas supera la oferta y nuestra capacidad de entrega de vacunas también supera la oferta. El segundo, esperamos un suministro estable y nivelado hasta finales de febrero. Y tercero, vamos a inmunizar a nuestros grupos actuales 1A y 1B durante los próximos meses. Al ritmo actual de producción de vacunas, estaríamos viendo a principios del verano antes de pasar al siguiente grupo. Esta mañana en la Junta de Comisionados discutimos el tema de las vacunas. El área ha recibido 48,000 vacunas y se han administrado alrededor de la mitad. Cuando aumente el suministro de vacunas, se considerarán abrir centros adicionales. Una buena noticia es de que la compañía Johnson & Johnson tiene una vacuna candidata que esperan presentar para su aprobación pronto. Esa vacuna está diseñada como una vacuna de una sola dosis. También debemos contar con el equipo y recursos adicionales. Vamos a continuar vacunando hasta terminar la fase 1B, que es para personas mayores de 65 años o mayores de 18, quienes tienen condiciones de salud crónicas. El número de personas que tienen más de 65 años y una condición física complicada es enorme. El condado de Nueces tiene aproximadamente un 50% más de personas mayores de 65 años que el resto de Texas y tenemos más personas con afecciones de salud. No se va a realizar una sola clínica. Tenemos más lugares para administrar la vacuna. También estamos rastreando la primera y segunda dosis. No desviaremos las segundas dosis para que podamos obtener la primera dosis para más personas con la esperanza de que la oferta aumente. Quiero también agradecer a los bomberos de la ciudad de Corpus Christi que llevan a cabo el programa SOS para inmunizar a los residentes que están confinados en sus hogares. Estoy orgullosa de todos los demás que distribuyen las vacunas en todo el condado, los hospitales, farmacias, centros de atención, entre otros. Y finalmente quiero agradecer una vez más a todas las personas que trabajaron el día de ayer en el Centro de Exposición Richard Borchardt y a todos los que esperaron pacientemente para recibir su vacuna.
Thank you, Gabby. Good afternoon. Annette Rodriguez, Health Director. So I'm going to start with the COVID-19 statistics for Nueces County. First slide, thank you. So if you see here, you see at the far right, 301 cases. And if you just look, it gives you a daily count. And today we're at 208. So again, the numbers are starting to go up and down, at least from 301, they're coming down. For last week, right in the middle, if you cut it in half, there were 1,112 cases. For this week, there were 1,095. So almost the exact number of cases, which is a lot of cases per day and per week for Nueces County. Next slide, please. If you look at the pie diagram, you see numbers at the bottom that talk about the people that have recovered here in Nueces County. 31,040 people have recovered from COVID-19. 2,872, almost 3,000 people have active COVID-19 currently today, and a total of 642 deaths that I'll talk about more in a few minutes, for a cumulative total of 34,554 cases of COVID-19 in Nueces County. Next slide, please. This graph depicts the hospitalizations, and the good news here is that if you look at January 18th, 2021, we had 193 hospitalizations, and what you're seeing now is you can see that gradual decline. So we're down to 167 cases that are actual patients hospitalized today in our hospitals with COVID-19. Unfortunately, you know, this is still too many. 130 used to be the ICU capacity. We're at 167, and these are just COVID-19 patients. Next slide, please. These are the ICU patients. You can also see a slight decline, you know, here. But we all know that first you get the disease, and then you become hospitalized. After that, you might go to the ICU. Unfortunately, some people will pass away from the disease, but we also know that there's a lag in the deaths. Next slide, please. So these are the deaths for Nueces County, 642 deaths today. We had 8 deaths today. So my deepest and sincerest sympathy to the families of those that lost their loved ones due to COVID-19. 8 of those individuals were males, and 4 were males and 4 were females. And they were in their 50s, 60s, 80s, and 90s with comorbidities such as diabetes, heart disease, and high blood pressure. Next slide. And this basically just shows you the last 2 weeks of COVID deaths here in Nueces County, every day except January the 18th, 2021, when there were no deaths. But if you look at that, the far right, last week, 21 deaths in 1 week due to COVID-19, and this week, 26 deaths due to COVID-19. So I'm going to pivot, and I'm going to talk to you about the health district and some of the things that we have going on currently, and I think everybody's mentioned it. So I'm going to start with yesterday also. The health district had its 5th COVID-19 mega vaccination drive-through. Of those vaccinated, 66% were over 60 years of age. In fact, 80% were 50 years of age and older of all the people vaccinated, which was over 5,200 people vaccinated yesterday. Most individuals were from Nueces County, but other neighboring jurisdictions such as San Pat, Jim Wells, Clayburgh, along with 47 additional counties were also served by the hub, as well as over 200 states. So people came from out of state to get their vaccine. We are having our next drive-through clinic this Friday at the Richard Borchardt Fairgrounds, January 29th, and we're starting sharply at 11 a.m., and it'll end at 7 p.m. We'll close at 7 p.m., so please be on time. Now, this drive-through is very different from all our other drive-throughs. It's specifically for second dose patients who received their initial injection at our drive-through on December 29th, 2020. Those individuals will receive a text message with a magic link notifying them of the date and the time of the second dose clinic, which I just mentioned. It's Friday for those specific individuals. There's 500 doses specifically for them with their name on it. As a reminder, vaccination distribution continues to be distributed through a phased approach. Phase 1A, it includes the hospital staff, long-term care staff, EMS, home health care workers, and residents of long-term facilities, as well as the associates. Phase 1B includes those 65 years of older without any type of medical condition, and also 16 years of age and older with at least one comorbidity that puts them at increased risk for getting COVID-19. We continue to receive concern about getting the COVID-19 vaccine to those individuals who are homebound. As the mayor mentioned, we are working closely with the Corpus Christi Fire Department on a plan to reach these populations that cannot physically make it to the drive-through or have other limitations that keep them from being able to attend one of our mega vaccination sites. We completely understand that a drive-through event is not for everyone. In fact, I tell everyone that the drive-through is for the masses. My 81-year-old father also decided he wanted an appointment with a doctor in order to get his COVID-19 comfortably. And so that's what he's going to do. So I do understand. The drive-through clinics are to serve these masses of people in these types of events. They're definitely not intended for everyone. And again, that's why we're working with Corpus Christi Fire Department to serve this population. The issue right now, as the judge mentioned, is that the demand for the vaccines outnumber the supplies we are receiving. We've all heard that. We do not have control over that issue, but we are doing everything in our power to get it into people's arms as quickly as it comes in when at all possible. For providers, doctors, physicians who have not received vaccines and they signed up as a provider, I can only advise you to be patient and to be ready. President Biden is promising 10 million vaccines to each state for the next 21 days, which is a 16% increase. So we do expect to see increases in the number of vaccines that we will start receiving to our communities very soon. We're also hearing, as the judge mentioned, that Johnson & Johnson is working hard on phase 3 clinical trials to go to the Food and Drug Administration for their emergency use authorization, their EUA. If this is approved, it will really help our situation here, and it'll help get us vaccines that only require 1 dose instead of the 2 doses that we've seen the requirements are for both Moderna and Pfizer. As we continue to vaccinate with a sense of urgency, we advise the public to continue to follow the public health prevention strategies. Continue to wash your hands 20 seconds at least, wear your mask, and practice social distancing. COVID-19 is still amongst us and will be until everybody is vaccinated or has built up immunity, natural immunity, by getting the virus. Stay well, and as always, stay protected. Thank you. Oh, yes, I also wanted to mention, thank you, Gabby. I also wanted to mention that while we are talking about plans for the fire departments to have vaccines for the elderly and for the homebound, they currently do not have vaccines for the public. And so I'm encouraging people not to go over to the fire department looking for vaccines, because there are no vaccines for them to go and pick up. There's no appointments for them to go and sit down at this time. We are working on those plans, but at this time, that is not yet here. Again, the demand for the vaccines exceeds the supply, and as soon as we have that program ready to go, we will let the public know, and we will get started quickly. Thank you.
En las últimas 24 horas se han reportado 208 casos confirmados por el coronavirus. 31.040 pacientes se han recuperado por completo. 167 continúan en el hospital. 42 personas están en la unidad de cuidados intensivos. 2.872 son casos aún activos. El día de hoy se reportan 8 fallecimientos. A la fecha, los fallecimientos totalizan 642 personas en el condado de Nueces solamente. Le quiero enviar nuestro más sentido pésame a todas esas personas. El día de ayer, el Distrito de Salud tuvo su quinta megacampaña de vacunación. De los vacunados, el 66% tenía 60 años o más. La mayoría de las personas vacunadas son del condado de Nueces, el resto de 47 condados diferentes. El siguiente día de vacunación en el Centro de Exposición Richard Borchardt va a ser este viernes, comenzando a las 11 de la mañana. Este día es solamente para pacientes que van a recibir la segunda dosis y quienes recibieron su inyección inicial el 29 de diciembre del 2020. Estas personas recibirán un mensaje de texto notificándoles la fecha y hora de la clínica para la segunda dosis. Les recordamos que la administración de las vacunas está yendo por fases. Comenzó con la fase 1A, que incluye el personal médico y trabajadores de salud. La fase 1B, que es la que está actualmente siendo inmunizada, incluye a las personas de 65 años o más sin una afección médica y a las personas de 16 años o más con una condición de salud que los pone en mayor riesgo de contraer el COVID-19. Para las personas que están confinadas en sus hogares, estamos trabajando junto con el Departamento de Bomberos en un plan para llegar a esas poblaciones que no pueden acudir físicamente a la clínica móvil o que tienen otras limitaciones. Las megaclínicas móviles son para servir a las masas en este tipo de eventos y definitivamente no están destinadas a todos. Actualmente la demanda de la vacuna supera los suministros que estamos recibiendo y nosotros no tenemos el control. El presidente ha prometido 10 millones de vacunas para cada estado durante los próximos 21 días. Mientras que la compañía Johnson & Johnson está trabajando en su vacuna, la cual será presentada pronto ante la Administración de Alimentos y Medicamentos, o FDA, para su aprobación. Esa vacuna requiere de una sola dosis. Le seguimos pidiendo que tome todas sus medidas de salubridad en lo que continúan los esfuerzos de vacunación. Asimismo, le queremos pedir a todos los residentes que no acudan a las estaciones de bomberos a recibir su vacuna, ya que ahí no se están administrando las vacunas y los bomberos no cuentan con vacunas en las estaciones de bomberos. En cuanto tengamos más información de otros lugares a donde puedan acudir, se la daremos a conocer.
Thank you, Gabby. That will conclude our COVID-19 briefing for the day. Questions? No? Okay. Thank you very much.